with you. Thanks for the introduction. It's good to see and meet some of you electronically, since that is the way we are all working these days. I am here, and you'll see in another moment where I am sheltered in place. I have a picture of my home because it relates to this conversation of sustainable health in procurement. And I'm really happy to share with you the work that we're doing in collaboration with the UN Development Program and a few UN agencies, which I'll explain, and particularly to hear how the work as it develops in this, what is a 4-year project, we're in the 3rd year, how we can connect you to this work, and how what of the work that is ongoing would be useful and supportive to you. And so I look forward to speaking short enough so we have time for questions and discussion about the aspects of this project. And I know for CAHA that I do not need to start by talking about why do we care about sustainability. And our hearts were with you as you suffered in recent time from the fires, from all the wildfires. We too, I am here in Washington State in the United States, where we have experienced wildfires. And you may or may not know that the GGHH Network Director, Nick Thorpe, 4 years ago was evacuated from his home during fires that raged from Canada through Washington, Oregon, and down to California. And it was 2 years ago at the Clean Med session in the U.S. where hospitals gave a very moving presentation about how many hospitals burned down and the kinds of evacuation. Of course, we also have hurricanes and we have floods, and all of these are not only affecting the health of our people, but our ability to be resilient and be the last facility standing so we can protect our community. Coming a bit closer to home, this is where I sit as we speak in this small houseboat. I am floating at the south end of the Salish Sea, and it is the sea, so I float up and down twice a day. You can see on the far left picture is the pole that the dock that I am attached to rides on, and that's at low tide. On the far right, you can see the pole now that I'm looking over the top of it at high tide. So my home life is very sensitive to sea level change. And there's another photograph of sea level response planning for my community that demonstrates in blue currently how many times it floods per year if we have a 1 meter or a 3 meter sea level rise. And some people say that I am lucky because I can float away in this, when the sea level rises occur, but it means I'm quite attuned to the issues of climate instability. And just to say, this photograph on the right of the great blue heron, which often greets me if I have been away for work, for travel, and I return home and the herons get used to habiting my dock, that's a sign for me of hope, because we had lost the heron population until the pesticide DDT was banned in the United States, and the herons and the eagles have all had a resurgence in the last 30 years as a result. Now to talk just a moment about how this work on sustainable procurement links directly to the mission and the goals of healthcare without harm. You can see the overarching strategy and vision and mission of healthcare without harm, looking to transform healthcare worldwide, and certainly the leadership you provide in Australia is significant. And I hope you all know how much in global fora Healthcare Without Harm holds up the leadership of CAHA and the work on policy related to climate and health in Australia. But together we are working to transform healthcare.
Susan, My apologies. It's Rachel Martin speaking. Could I ask that everyone please mute? It's quite noisy and it's a little tricky to hear. Thanks. Sorry to interrupt, Susan. Thanks, everyone.
Thank you. No worries. And then just to highlight, among the 3 overarching goals of Healthcare Without Harm, number 1 is protecting health from climate change. But number 2, which is what I have expanded in this particular slide, is looking at how we transform the global supply chain so that we leverage our significant purchasing power to move policies and markets for more ethically produced, healthy, sustainable products and services. And I'm going to talk a little bit about how we're going to do that. Also to link the 10 goals of the Global Green and Healthy Hospitals Network with the Sustainable Development Goals. And I pulled out, as you can see, purchasing or sustainable procurement is one of the goals. And how it links to for all of us, our main goal, good health and well-being, but also, and that's SDG 3, but also the Sustainable Development Goal on responsible consumption and production, and the one on climate change, among the 17 goals that are all interrelated, that this work that we do together contributes to our countries being able to meet their obligations when the entire 105 nations of the world in 2015 adopted the Sustainable Development Goals. And as your representatives go to New York or Geneva to highlight how they're implementing, I hope that they are in touch with you or that you are in touch with them to share the case studies that are good practice examples that will make them look good in these fora. So now to turn to this project and the outcomes and resources that I hope will also be useful to you. We have 4 main objectives of the Sustainable Health in Procurement Project. We call it the SHiPP. The first is to set standards and criteria, whether those standards are accreditation standards or policy standards, but standards for the implementation and integration of sustainability into procurement. The second 2 objectives are to build capacity for the implementation of those standards and criteria. So the number 2 objective is to build capacity within and among health systems and supply chain officers. The third is to build capacity within the supply chain and the suppliers themselves. So to work with suppliers on their manufacturing, packaging, distribution to implement sustainability into their own operations and their products. And then the last objective is to develop measurement systems and to be able to realize what are the impacts of this work. The work was preceded by work, and I'm going to show these are partners with whom we are working. So Healthcare Without Harm and the UN Development Program are the leads in this SHiPP project. UNDP is the lead because they serve as the secretariat for what's called sustainable procurement in the health sector, which you can see on the screen, 7 UN agencies and 3 global funding mechanisms that are all participating together in an informal task force that since 2012, they've been working to integrate sustainability into the products and services that the UN buys in the health sector, which is about $5 billion annually in health products. So by setting these standards, we influence UN procurement, and in some ways, since many ministers of health will look to and adopt WHO pre-qualification standards or UNICEF, or are receiving funding from the Global Fund or Gavi, that they will also implement these standards. So they go a bit farther and wider. However, the project itself, we are working in 10 countries. UNDP is responsible for the lower middle income countries on the left, and Healthcare Without Harm is responsible for the emerging economies on the right. And you can see that these countries include Argentina and Brazil in Latin America, Moldova and Ukraine in Eastern Europe, 3 countries in Africa, Tanzania, Zambia, and South Africa, Vietnam, China, and India in the Asian region. Plus, Healthcare Without Harm is working to scale up in Latin America. So we are working in 3 additional Latin American countries and in 3 additional countries in Southeast Asia as these products and services criteria move forward. We also are working quite closely with the Practice Green Health group of environmentally preferable procurement in the U.S. and our colleagues at Healthcare Without Harm Europe as they implement and collect case studies of how health systems are implementing the Sustainable Public Procurement European Union Directive. So we have case studies from both the U.S. and from various European countries that are good practice examples for others to replicate. The main outcomes are to look at the greenhouse gases within our supply chain, what kind of resources we are using that could be conserved, and toxicity. So that some, and these are just examples of outputs, are looking at what are the chemicals of concern in healthcare products, how can we reduce and eliminate them and substitute for less toxic products. In terms of climate change and greenhouse gas reduction, looking of course at the procurement of renewable energy, but also unique to the health sector, the less carbon and also happen to be less costly anesthetic agents, energy efficient biomedical devices. I'm looking for the first country, and we're working closely now in India to see if someone will set a standard for energy labeling of biomedical devices so that when you buy a refrigerator or a television, you can see the energy rating, but if you buy an X-ray or an EKG machine, you cannot yet. So I'm looking forward to that. And then looking at water quality, looking at waste treatment and commodities and effluent in manufacturing itself, effluent in pharmaceutical manufacturing, including the lives and drinking water of children downstream. So there's some work ongoing in India and moving in China in that way. You all, I think, have seen this report that was published by Healthcare Without Harm together with the consulting group Arab last September that shows that if healthcare were a country, if the global health sector, it would be the 5th largest greenhouse gas emitter. And then as we look to reduce greenhouse gases in the health sector, we need to look at the supply chain. Because as what you can see in just these 3 examples of health sector greenhouse gas emissions in China, India, and Indonesia, that 70 to 80% of emissions in our sector are a result of Scope 3 emissions, most of which come from the supply chain, and many of which, as this slide from Victoria Health shows, many of which are indirect costs and are emitted during manufacture and transport. So as we identify carbon hotspots in the health sector supply chain, we need to then work with those suppliers and manufacturers to change their processes. And for example, the National Health Service in England, which you may have heard, has made a commitment to be net zero carbon by 2050, and they're well on their way. They told us last week that they have told 50 of the top suppliers that they want them to be a part of the Carbon Disclosure Project, and so that they will be tracking the greenhouse gas emissions of their suppliers in that way. You can also see from this slide that in 2010, the Southern Health Study showed that almost 60% of the carbon footprint of Southern Health was related to the procurement of goods and services, and that Victoria's public health sector alone represents 20% of Australia's public health sector spend. And as we begin, especially to look at hotspots, we're looking at spend and at volume to identify those top spots for intervention for reduction. And there are a number of tools. For example, the Sustainable Development Unit in the UK developed a tool for, it's called a sector guidance note for greenhouse gas emissions of pharmaceuticals and medical devices. Just to say some of the work we've done so far, and then I have 2 slides or 3 slides of tools and resources that I will make sure that Carol has access to, and you all can link on the internet to receive these resources as you'll find them useful. In the first 2 years, we did assessment and inception workshops in all of the countries. In the first 2 years, we were invited by UN Environment through the One Planet program for Healthcare Without Harm and UNDP to become the working group leaders for the health sector task force of sustainable public procurement. And we have a series of partners within other sectors that are participating in the health sector, including infrastructure, buildings, and electronics. We've hosted so far 2 supplier forums with suppliers of medical products and plan to have 2 more, but this year it doesn't look very promising for any big meetings or travel, and we'll see whether we can pull off a remote suppliers forum. We granted in 2019 for the first time Sustainable Procurement Awards in Brazil and in 5 other countries in Latin America. In 2019, India published their first Green Hospital Accreditation Standard and began implementing within the 7,000 member hospitals in the Health and Environment Leadership Platform. And they have particular language about sustainable procurement and a particular standard in that way. And our colleagues in Europe facilitated a global survey where they're benchmarking the disinfectants, surface and instrument disinfectants being used to identify safer alternatives and the market research to leverage those markets. During 2020, we will be publishing a new report on carbon hotspots in the next month. It's called the File Notes. It's a companion version to the report from last September on carbon footprinting of the health sector. And then we'll be developing tools for procurement for carbon reduction that your input will be very helpful too. We have finalized a guidance document, which will be a Global Green and Healthy Hospitals guidance document that has a self-assessment checklist, has a list of 27 high-impact priority opportunities as hospitals are getting started and saying, what can I do first to implement, and a number of online training modules and materials for training trainers. One of the main outputs of the Sustainable Health and Procurement Project is this Sustainable Procurement Index for Health. And this is work that UNDP is largely responsible for. We will be advising and participating to identify both indicators for manufacturers and suppliers, as well as indicators to say what is a sustainable procurement product. And looking as we identify those criteria to work with suppliers to implement them and work with health systems to use the index. I'm now just going to run through a number of tools and resources, starting with as we are all working together on this transformation of the supply chain, looking at how our work in the health sector and our work to transform key markets in the health supply chain leads to our leadership for other sectors in the global economy and how we integrate health into all policies. And just with that, a quick run through so you'll know what's available and what to ask Carol to help you access. Most of this is already on the web and the web links are provided. So we have treatment technologies for healthcare waste management that are non-polluting. We have that anesthetic gas toolkit. We have a fact sheet from Europe on reducing the carbon footprint of healthcare through sustainable procurement. We have, as I mentioned, this high impact priority list, guide to fluorine, criteria for manufacturers, guidelines for procurement of safer medical devices, tools on PVC reduction, a number of publications on how to identify chemicals of concern in health products and shift to safer substitutes. There is a Sustainable Procurement Specifications and Resource Toolkit developed by Practice Greenhealth that has the specifications for 120 products that you can access. I noticed that one of the priorities in environmental procurement for Victoria is to incorporate total cost of ownership. We have a total cost of ownership tool and spreadsheet for you to populate to analyze cost of products beyond the price. And the last page of tools is, as you can see, a responsible electronics, eliminating mercury, greener cleaners, energy efficiency, and prioritization for recycled and reusable products. With that, I hope I still have time to hear your thoughts and questions and think more with you about how we can connect and collaborate. Thanks.
Thank you very much, Susan, for outlining all of that and packing a lot of information for us to look at into a short presentation. Does anyone want to jump in with some questions?
It's Emma here from Western Australia in the South Metro Health Service. Thank you so much for that. That was phenomenal, and I think it gives a glimmer of hope in this somewhat uncertain time. I have two questions. One, I guess, the first is, will your slides be available for us to go over at a later time? There's a lot of links and a lot of information in that I would like the opportunity to go and read up on.
Yeah. I'll send the slides around to all GGHH members in our region, along with the recording of Susan's presentation.
Fantastic. No, that's great. The other question, and I guess it's just something I'm struggling with at the moment within our health service, is losing this picture of environmental sustainability in the current instability, both biochemical as well as environmental, with the bushfires. And there's a lot of emergency action with not a lot of ability to plan future action. So I wanted to, I guess, ask you and the others on the call what you feel or how you feel we could help to continue this discussion with the chaos that's going on at the moment.
Thank you, Emma. I would love to hear from others how you think how to maintain the conversation during this current crisis. One thing that we are doing is we have Healthcare Without Harm has produced a fact sheet on COVID waste management, because we've been getting a lot of questions from GGHH members, many of whom have waste as one of their key goals. So we have highlighted all of the resources, that sort of the best, shortest resources from WHO in a two-page fact sheet, and a reminder to people that COVID-19 waste is no different than infectious waste, and in many ways it is less hazardous than other kinds of biohazardous waste. And so creating, as they have in India, a requirement to separately label COVID waste is, instead of managing all of the healthcare waste stream and using non-burn treatment technologies such as autoclaves or microwaves to treat the waste so it is sterilized and can be then disposed with any kind of regular waste. But thinking about what challenges people are facing in terms of supplies, and then of course the waste that's generated from the management of these supplies, is one way. Do others want to talk about how they have been able to stay engaged? And someone is asking in the chat, what about pharmaceutical waste? Most national, shall I go ahead and answer?
Yeah, go ahead.
Okay, so most national regulations require incineration of pharmaceutical waste at a very high temperature. There are inertization processes for pharmaceutical waste and called chemical cremation aspects, alkaline hydrolysis that can be used to render pharmaceutical waste inert. Major problems both, but the sort of stock rotation and supply chain issues so that we aren't having to deal with expired pharmaceuticals and are only then dealing with the pharmaceutical waste from excretion. But that's a major issue in itself. That I sit on the Bureau of the International Conference on Chemicals Management, and one of the emerging issues and issues of concern to the global community is the fact that in 75 or more countries in the world that effluent or excretion has resulted in active ingredient of pharmaceuticals in a lot of people's wastewater that is not adequately treated by municipal waste treatment.
Mm-hmm. And to respond to your question a little bit, Emma, hopefully we'll be able to talk a bit more about that soon when members give their updates and talk about how COVID is affecting them and what their plans are going forward. So yeah, hopefully we can get everyone involved in that soon.
Thank you.
And so the people asking about access to documents, yeah, I'll send around whatever is able to be accessed now to everybody, to all the GGHH members.
And if I could ask you, as you use the documents or look at the case studies and try to replicate, if you will share your experience, both good and less good, this is the network that we're building that is even more emphasized by this having to only deal electronically and by distance with people, but collecting your stories of how you implement any of the tools and did they work or didn't work would be so valuable to others.
Oh, Susan, hello. Janet here. Can you hear me?
Yes. Hi, Janet.
Hi. So we've got to collect stories on this, on the implementation of some of the things. I mean, that'll be really interesting, I would think. I can certainly try and do that, but I'd like to see them. I'd like to see your presentation and have a little bit more of a feel, get a feel for it anyway. But I guess this is something that really does worry me. Recently, I think it was yesterday, in the Sydney Morning Herald, I saw this section on emission revenge. I don't know if anyone's familiar with this, but apparently after we have these pandemics, then things do happen. And apparently, as a recent example, China has now decided that they're going to build more coal-fired power stations since they've had the epidemic, the pandemic. So that's kind of what they call emission revenge, I understand. Has anyone else heard about this? And I just think we've got all these things to combat now. We've got, in Australia, we're not out of the woods with fires. In another couple of months, we'll be having more bushfires, we're told, by the Rural Fire Service. So it's a worry, the whole thing, isn't it? We're mixed up. I believe there was a good GGHH, that was a Healthcare Without Harm presentation, which I missed yesterday at 7:30, on how the two can go together, cause and effect, the virus and climate change, what's happening. I missed it, unfortunately, and I'd love to hear what was said and what strategies came out of that to help us. Thanks.
So yeah, Janet, that will be recorded and we'll share it with members when it's available.
Oh, that's wonderful.
Thank you.
Thank
that
you,
was
Susan.
at 10:30 at night my time, so that's nice to know it'll be available. It was a little late for us in WA.
It was really good, and one among the things that came out, it was a very active. They used a media called Sligo, together with the School Foundation. And so there was a lot of interaction among the 800 people who participated.
Oh,
and
wonderful.
There was a graphic artist who then did an illustration of the discussion that is really going to be beautiful, and it is beautiful, but it will also be online. And Janet, I just wanted to respond to what you said about this backlash. There was last Friday a webinar that was done by Greta Thunberg, where Dermot Campbell-Lendrum from WHO and Naomi Klein from the U.S. were speakers. And Dermot was responding to the question, will COVID help our planet? Is COVID the cure for planetary health? And he said, well, if you look at the air pollution over China during the outbreak and the shutdown, the pollution reduced considerably, but as soon as the economy started back up, the air pollution returned. So COVID is not a cure for the planet.
No, okay, interesting. All interesting. I'm looking forward to hearing what I can from the Healthcare Without Harm presentation. That sounded really good. Thank you so much, Susan. Thank you for that response to the backlash.
So I guess looking at this backlash, sorry, it's Emma here again in WA. In regards to looking at this, what is going to be a backlash, and I think what does GGHH or does Healthcare Without Harm have some sort of plan in terms of ensuring that the link between climate and infectious disease is pointed out, and that there's a forward planning to make sure that we do work on climate at a greater ferocity, not simply return to business as usual. So how do we actually avoid the unmanageable by managing the avoidable at this point in time?
Good
is there a strategy?
I think we're at CAHA, we're trying to work out how to do that at the moment, but in a way that is sensitive to the crisis that we're currently in with COVID. So definitely trying to continue the work on climate change and highlight where there's similarities in dealing with pandemics and climate change, but doing it in a way that is sensitive and there will be more to come soon. But it's still early days for us as well. So
good.
And a thought to add in terms of the more local context within our organisations is there might be, while like we've discussed, the virus itself is not necessarily a cure or may not inherently help the trajectory we're trying to drive towards, there may be elements of like cultural change that had to occur really quickly to allow us to adapt to this situation that we can try and harness. Like for our organisation, we've not particularly done well in the past at allowing staff to connect digitally and have virtual meetings or work from home. It's always been quite a grey area for support staff, whether you can work from home or not. But we've had to really quickly develop policies and tools there. So the sustainability team are very keen to harness that and try and, in the wake, once all of this settles down, try and hold on to those elements.
Sarah Bendon here. I kind of feel the same too. That I've heard a lot of conversation of people saying, look what's possible. Look what can be done, quickly. And I think that there are a whole lot of opportunities that have come out of it because these processes and systems are now up and running. I was going to just say another thing. Look, I don't work in the health protection space, but I know that in the climate change mitigation planning with our department, so Department of Health and Human Services in Victoria, has been working on the broad been, I guess, well recognised. Whether this
Sorry, Sarah,
another,
you're dropping out a little bit.
obviously,
Sorry.
The connection between, particularly with the increase in certain types of viruses and, the pressure between the margins and the areas that have had deep conversation.
You might be able to hear better if you turn your radio off. This is a nice flow of conversation, but I am mindful that we need to push on with our agenda. So,
sorry, can I just add? This is Rachel Conville. I just wanted to add one last little thing.
Yep.
We are in a really unique position in that we work in sustainability and healthcare, so our lives are completely disrupted by all of this. I also work very closely with Sustainability Victoria, who are another government department. They're business as usual. They're getting on with making sure Victoria becomes as sustainable as possible with all of the things that they normally do. The only difference is that they're working from home. So all of this stuff is still happening, maybe not in hospitals at the moment, but bigger picture sustainability stuff is still going on. We are being severely disrupted with this in terms of our sustainability journey.
Okay, thank you, Rachel.
That's reassuring to know, because from the inside of health, life has ground to a screeching halt with every conversation except COVID.
Agreed. This is Rachel calling from the Southwest, and that's absolutely correct, including this reassignment of my role, which is really unfortunate. But there's a lot of social media out there, and I know that there's a lot of people on the ground who are looking at the opportunity of taking this time to stop and really consider about, in further to Susan's comments about our procurement, it gives us time to actually think about what we can do going forward. It also requires some really big change from the big speakers and the big policymakers. We're starting small in the Southwest, but with any luck we'll make some big change. And Susan, thank you for your talk, because it was extraordinary. I really enjoyed it. Thank you very much.
Really was, yeah.
So how about if, unless anyone objects, I might jump over giving my GGHH update, and we go into your member update. So if you're able to give a quick summary of what's happening in sustainability at your health institution, and how it's being affected by COVID, and what your